أهلا وسهلا بالجميع. Welcome everyone to this third webinar organized by the Independent Lebanese Committee for the Elimination of COVID, ZeroCovidLB. Today we have our guest speaker with us, Sara Chang. We're very happy you can join us today. Sara is a US-based public health professional with over 15 years of experience spanning government and nonprofit agencies. She provided support for the US response to Ebola and Zika, and has worked extensively in positions related to infectious diseases and social justice. She recently relocated from Beirut, where she provided consulting support for non-health actors in the COVID response in Lebanon, and as everyone knows, has been very widely involved in a lot of things COVID in Lebanon. We're very thankful for everything you have been engaged in. Today, we're going to be discussing the Lebanese outbreak throughout the autumn and early winter, the impact of the opening on Christmas and New Year, and thoughts regarding the national plan recently shared by the authorities in Lebanon, and paths ahead and challenges that we face with the new strain and variants coming up. With the first half, Sara will be presenting some material. She and I will then have a brief discussion, and then we will open it up for everyone to be involved. So, Sara, over to you.
Great, thanks, Jade, and thank you so much for the invitation of the group as well to host this. I'm really looking forward to great discussion. So I'm just going to take a moment to share my slides with you. Just want to make sure that's coming through okay before I launch in. Jade, can I get a thumbs up from you if it looks good?
Yes. Okay,
fantastic. So I just wanted to review a few things with you this evening as a way to kick off our conversation. So as Jade mentioned, I'm Sara. This is my family, and this is a picture of us just outside Beirut when we were still living there. We went for a hike and grabbed some brunch and some delicious food. So my background is in public health. I'm a big public health nerd, and I think based on the people in this meeting, I think you all are probably very familiar with all the terminology, but just in case health is not your realm or area of expertise, public health, one reason I love it is because it looks at health from a population perspective. So it really backs up and looks at whole communities, whole areas to understand what's going on. And the foundation of public health is epidemiology. I'm sure a lot of you are probably following epidemiologists in the country now. And epidemiology is the science of looking at the spread of disease across those populations. So it's really the foundational science of public health. And of course, with epidemiology, you need data. So that's one reason why I look at data so much in Lebanon to understand what's going on with COVID-19 in the country. So for my time this morning, just sharing some of these slides with you, I wanted to look at why data is important and some of the different ways that I have used it to understand what's going on with the outbreak in the country. So of course, data is used to build an understanding of the situation, what's actually going on with the spread of this infection through the country. And it's very important to look at multiple indicators, not just one, to have a good understanding of what's going on. So the example I use here, it was from a couple of months ago when it looked like cases had plateaued. And if you just looked at the case number, of course, that was the case. That was an easy assumption that you could make. But when you start to look at positivity and testing rates, you would start to build an understanding that actually what had plateaued was the amount of testing. So it wasn't identifying any more cases because the testing was no longer matched to the size of the outbreak in the country at that point in time. So that's why it's important to look at all the indicators as a whole and not just pick out one or two. They all work together to build a narrative of what's going on. Another reason why data is important is because it can build trust and ensure transparency and accountability. So with this particular example, not to pick on WHO, this was very, very early, I think, when a lot of the organizations were trying to build their communications to the greater population about what was going on. But very early on, when things started to accelerate a bit with the outbreak, they had said that hospitalizations had doubled and tripled within a month. And while they certainly had increased, it wasn't at the rate that they had suggested. So this is why it's also important to have the data to look at to, oh, sorry, I'm just seeing that I need to admit someone in the room. Thanks, Jade. So that's why it's also important to have data to make sure that we all have a common shared understanding of what's going on with the spread. And while certainly there are messages to be communicated, such as, there is a significant increase in hospitalizations, we also have to be real and transparent with what those rates are, so everyone has an understanding of what's going on.
Sara, you could make me host again while keeping the share screen. So that way I will just admit people without bothering.
I will switch it over to you. Thanks, Jade. Great, did that work?
Yes.
Excellent, okay. Great, and then another advantage of having strong data is you can use it to inform and adjust interventions. So the example I put here was a quick analysis I did on the localized lockdown approach. So this is something that was used back in the fall and October when it was by specific geographic areas, the lockdown approach as a way to contain COVID. So with something like this, it would be really, really important to have granular data, very, very specific information to understand how the intervention is working to then adjust it. And in this case, it wasn't implemented very long. So the results, if I recall, I think it was only 2 or 3 weeks. It wasn't really enough to demonstrate the effectiveness of this particular intervention. But regardless, it's great to have the data to understand if it's working or not, so adjustments can be made in the plan. So all this, I've pulled together some different resources for data to help people understand what's going on with COVID in Lebanon. And some of you, I think, are familiar with these, but just in case not, I'll just review them. So the first one is a threat indicator, which just provides a summary of where things are at in the country as just a quick glimpse to understand what's going on. I have a Dropbox folder with all the daily reports because each agency, DRM, WHO, and the ministry all publish them separately. So I just download them and keep them all in one spot. So if you're a data nerd and you're wanting to look at the specific reports, I have all of them downloaded in different folders. I also keep a data spreadsheet that's publicly accessible. So a lot of the big picture numbers are in there. So if you're interested in making your own graphs or doing your own data runs, you can find the raw data in there that's been entered manually. And it's basically in an Excel format. It's in a downloadable Google Sheet. And then there's also a dashboard of various key indicators for the COVID response that you can go down and have an understanding of what's going on across the country. So this threat indicator I made because I had created the dashboard, but there still seemed to be difficulty pulling together all the information and understanding what's going on with COVID in Lebanon, and so people could make informed decisions of what they need to do personally. Just acknowledging that, there is the government, these community level actions that need to take place, but there's also the individual decisions that people need to make of their own level of risk and risk tolerance if they're able to make those decisions. And so I created this threat level indicator as a way to summarize, bring together all the different data and understand what is the current risk level for you. So it takes these 3 different indicators, and each one has its own coloring, so you can understand the situation with that particular indicator. And then on the right, you can see it's just an overall look at what this means taken together. So this is an important lesson in terms of, there is data, but it also needs to be interpreted, analyzed, and then translated into action. So it can't just stop at publishing data. And then in terms of the data sheets and the spreadsheet, it's easy, of course, to focus on 1 or 2 particular things and the daily reports, because I know we wait every night, right, for the daily reports to come out, which is understandable because I think all of you have seen in terms of tracking that and wanting to know what's going on every day. But it's also important to zoom out and look at the trends that are going on. And so it's looking at weeks and months over time. And that's why I created some of these different images to understand what's actually going on over time. Are things increasing or decreasing? Are they speeding up or slowing down? So by zooming out, we can look at that bigger picture. And then this is just a glimpse of the dashboard if you haven't seen it. It's also publicly accessible, and all the content is free to use for any purpose. So feel free to grab anything if it's helpful. But I do have a COVID by district map, so you can see if things are increasing or decreasing currently in the district. It looks at positivity, new cases, testing rates. And then there's also a long view when we get down there in terms of all these indicators since the very beginning of when the data was released. So this is a nice way to kind of, if you're not so into looking at the daily reports, but you still want to see what's going on, this is a chance to dig in and see where those trends are at. So in terms of taking all this data and then using it, the next couple of images are just different ways I have applied the data that's been gathered. So this one is a look at December and January. It's a bi-monthly view of the different indicators over these 2 months, just to have an understanding of what this holiday surge looked like. As we all know, there was an easing of restrictions over the holidays and increased socialization. And for a lot of different reasons, the cases went up. And then shortly thereafter, the hospitalizations and the deaths also increased. So we can see that across these different indicators, how that came over time. And things have started to stabilize, fortunately, but it's stabilizing at a very, very high rate. It's definitely not back to the pre-holiday time. Yeah, I think I know there's a lot of excitement around the vaccine, but it's also just hesitation knowing that things are going to be eased over this 4-phase plan. So I think it's just something to keep in mind that it's great. It's fantastic news that things have stabilized, and we still have to be very, very vigilant because there's still a lot of things going on. And I know Jade will talk a bit about the new variants and the threats there. So I just wanted to give you this image as an understanding of what's happened over the last couple of months. This is another way I use data. And so this was data that was released by authorities as well as by reputable news agencies, just understanding all the information that's coming out about the vaccine rollout in Lebanon. And so there's the numbers of how many are coming each quarter and that they're coming in weekly installments, but that can be hard to understand. What does that mean for reaching herd immunity in the country? So I created this image to kind of understand, what does this mean over the length of the year, practically? And the thing I think I will point out here that I was most struck by was that, at least as of right now, the current vaccine administration capacity only gets us to about 4 million administered doses by the end of the year. And that is on the assumption that has been released by authorities in terms of the 35 centers that can do, I think I put it on there, vaccinate 400 people per day. So that's looking at the whole country for those vaccination centers. So unless the public side of the administration capacity increases quite a bit, it's gonna only reach us to complete the second group, priority group, for administered vaccines. And again, this isn't just on the public side. I know that there's going to be private efforts for bringing in the vaccine. And we'll talk about that a little bit more later, but I just wanted to provide this graphic in terms of understanding what do these numbers mean for the country and reaching herd immunity, and the goal of getting 80% vaccinated by the end of the year, which at least on the public side doesn't look like it's right now logistically possible unless something significant changes. And then the last slide I have for you is just a reminder that not all data is numbers. So this was another graphic I made based on publicly available information, meeting notes that are published by different entities, as well as reputable news sources, in terms of trying to break down how COVID decisions are made in the country. And so this is the third version. Thankfully, I keep getting feedback of how to continually improve this and make sure it's as accurate as it can be. And so this is just an understanding of how the decisions are made. And then I have a little key in the bottom right. So the direction of the arrow shows the direction of influence, so how the recommendations flow up or around, because some of them are bi-directional. And then the types of arrows, the solid arrow is a formal relationship, so maybe something that's written in policy, and then the dotted line is something maybe more informal, where maybe meetings take place, but there's not necessarily something in policy built for that particular mechanism. So I created this to have an understanding of how decisions are made, because we'll often read in the news, oh, the COVID committee is meeting, but maybe we don't know where they land or where they sit in the particular structure. So then we can understand and trace where the decision is at and what's going on. and it's a good conversation starter, I think, in terms of thinking about the pros and cons of a structure like this. So at least in previous responses I've been involved in, it's very important to have clear roles and expectations and responsibilities. So it's something to think about as we look at this and trying to understand what's going on and who's making these decisions, and then how those pivot points, I guess, and understanding where the recommendations are leading, and those points where I guess information could be provided to help influence how the response is going. So yeah, this is just a reminder that not all data is numbers, and this is one way that we could use that information to then help inform the response and keep the public informed of what's going on. So these are all the slides I have for you right now. I know we will have continued conversation, so I really appreciate your patience as I walked through all that. I have my contact information there, but I look forward to continued discussion with Jade and with everyone else here on the webinar.
Thanks very much, Sara, for that. I think I'll share my screen in a moment, but before I do, I'd like to ask you what thoughts you have regarding, I mean, you already mentioned some points regarding the opening that we had over Christmas and New Year. Do you have any other thoughts to share about that?
Could I get a more specific question in terms of how we ended up here? Or
well, yeah, I think I mean one thought that one issue that came up was regarding the opening at the time. I didn't find it very helpful that the restaurants and nightclubs and all the events that were held and parties at the time were allowed to happen. And I would think that the logical thing, and of course there was to some extent, which I don't know exactly at what scale, there would be home gatherings as well. I would think that regardless of anything, if a wise approach would have been perhaps to actually lock down during that period, or otherwise not allow public events. And people might still, I mean, you could still either strongly advise them not to meet across households or lock down during that period. I would have thought that that would have, for example, avoided a few thousand deaths that we're having now and thousands harmed as well. So that is the broad thought that I have about that.
Yeah, agreed. Yeah, I know it's always the thing I find difficult with the policies is that I know there are so many pressures. Lebanon is facing a lot of different crises. One word I've had it phrased as is a syndemic. So it's this idea that health is interacting with all these other things and it's worsening. All these things feed into each other and they're very much interrelated. So we can't isolate health from everything else going on. And certainly over the holidays, I think we all saw how those different pressures and crises coalesced. And decisions were made in terms of where those costs were shifted. Yeah, certainly efforts could have been made, at least for big events, knowing that there's certainly, I mean, there's the term of the super spreader events where a lot of people get together and there's probably not much physical distancing and masking. So certainly steps like that. And even with the home gatherings, I know there was some debate about having the utility of a lockdown if people were still going to gather in houses, which I understand the logic of, but at the same time, with so much community spread, the idea of having restrictions is just to cut as many transmission chains as possible. So by that, I mean, you know, if you're reducing the number of contacts that people are having, if you can at least do that, reduce the number, then it'll help with the spread. You know, and it's going to continue in houses, it will continue in other gatherings, but if at least it's just reducing the risk. And we saw how those different pressures came through and end up totally overwhelming the healthcare system. And it's a very difficult state to then start a vaccination effort. And it's great that it's starting, but I think the healthcare sector is just exhausted. They've been dealing with this for months. And so it was decisions that were made. It's not the decision I would have made, but I'm not a decision maker. But certainly I think for me, the thing that's difficult in Lebanon is it seems like it's dichotomous of either it's full lockdown or full freedom. And in reality, I think it needs to be, at least in the chosen approach that the country's taken so far, there needs to be something in between to help reduce the risk. Because it's just some people have called it the yo-yo effect. It's just going to continue. And vaccines will certainly help with that, but it's not going to help soon. It's going to take a while. So yeah, sorry, that was a long answer, but it was just,
no, that's great.
I think a lot about the policy decisions, and I know we all have opinions on that. And I think it was just decisions that were made of where the cost was going to lie. And unfortunately, I think the cost lied with people's health.
Thanks very much, Sarah. Yes, what I have right now on shared screen is the daily new confirmed COVID cases in Lebanon on the left-hand side, and on the right-hand side, the cumulative total confirmed COVID cases, and we can see how it was. It hadn't been going so well along the months of particularly August, September, October, November. There was, it seems, a brief impact of the November lockdown that we had. But then we had the big surge after the opening that happened. It seems perhaps plus or minus a few days around Christmas, perhaps with people arriving, meeting up, and then after that, the cases a few days later increasing considerably. Now, my thoughts on this are, I think, one thing that, of course, a lot of people know, myself and my colleagues in ZeroCovidLB are advocates for the zero COVID approach. I like to mention one thing is that zero COVID, Lebanon was zero COVID about half a year ago. We were at zero or near zero daily cases. There was very little community transmission or none. And it's when we have zero community transmission that we've reached zero COVID, not necessarily zero cases, so long as we can isolate them fast enough and quarantine their contacts. So it isn't exactly a completely unimaginable scenario. But it seems we did have this opening, closing, and yo-yo effect, as you said, and yo-yo lockdown as well. It's been one after the other. Do you expect things? How do you expect things to change over the next couple of weeks now with increased opening, perhaps?
Well, one thing I track in the reports is compliance, and I know that that's probably largely subjective number based on the different districts and how much they're complying with restrictions. But at least it's some insight into what's going on across the country. And it's tough because of course compliance has dropped with the full lockdown over time, because a lot of people, if they're daily wage workers, or if they're dependent on the income, then of course a full lockdown, particularly without aid, is not viable. And I mean, even pre-lockdown, I think the aid is still very much needed, because there's been a financial crisis for months now, but that's a different conversation. So I think, there's this practicality of the population is also tired. But I worry that with the continued easing, that there will be increased opportunities for the virus to spread. And especially when looking at the plan, I I know they have kind of estimated dates of when they think those phases would kick in. I think in the places where I've seen it worked, and I know this is something Zero COVID kind of utilizes, is looking at more indicators of where those phases would be as opposed to dates. So epi indicators of, okay, this is how many cases we have, this is what the spread is, and then, from that, then making the decision to have the restrictions then match where the outbreak is at that particular point. And so for me, I wouldn't necessarily want to have dates because I feel like it sets up this expectation that if it's not met, then I think it increases public confusion when there's already a lot of confusion. So for me, I'd rather see indicators. It would be kind of triggers that then it would move into the next phase of easing. So that's something I worry about, is that we're similar to what happened with the reopening around the airport. I think things just kind of charged ahead. I think there was maybe a week delay with the dates, but they very much, the restrictions were still eased according to schedule, more or less. And so I think that's going to end up happening here. And the fact that there's already waves noted, it seems like that the folks who put together the plan are also anticipating that. So yeah, I think while things are stable now, I think it will go up again, unfortunately.
Yes, this is what we're looking at is the plan that was released last week. And it is, I find it quite worrisome that to begin with, waves are actually planned in it to begin with. Because if we expect a wave, I mean, a wave would signify lots of deaths and lots of harm happening. So that is what we actually want to avoid. So I would think that the wise approach would be to take actions to prevent these waves from happening in the first place. What I'm concerned about, and what my colleagues as well in our committee are concerned about, is that the country may be repeating the same mistake it did over Christmas by opening up. It's tough to say. It's perhaps impossible to anticipate the scale that we would be facing. But in any case, it's not a good sign, I find. And the other thing is, I very much agree with what you had mentioned regarding being responsive to indicators rather than presetting dates. The other thing that I find also concerning is the target that is placed, and of having less than 2,000 cases per day. But and this was placed in the context of returning from mitigation as a strategy towards containment. To begin with, we and many others had warned authorities for months to not follow a mitigation strategy because it was a time bomb. I mean, it was daily failures, of course, to different extents, but the road that, no country succeeds basically in following that path. We've seen many countries fail in that, but if I find it in the plan, it was firstly, in containment, we would try to isolate every single case and contain and quarantine all their contacts. And it didn't seem to me that the lessons of the over-reliance on self-isolation have really taken grasp. A lot of countries struggle with that as well. But I think, Lebanon wouldn't be better placed than others. And I also wonder if we have the capacity to contact trace so many people per day of cases and maintain containment.
Yeah, I appreciate you sharing your thoughts on this slide, and I had a similar reaction to the target that was put forth of the 2,000, because it, at least in looking at the previous stages of the outbreak, it felt like it was just kind of based on where it had kind of leveled out before, as opposed to like a real target of like, where would you want to be ideally? And yeah, you're right in terms of the easing and the waves that are expected. I think it's difficult because what ultimately, and for those that have followed my multiple tweets, I've said this before of the importance of a long-term plan. I think ideally, we want to get to the wave part. Like I think that's some of what you're saying, Jade, is that you would have actions and phases that are responsive to what's going on. It wouldn't just be easing and then expecting the waves. It would be that there are proactive steps to then prevent the waves taking place. Because it's just going to continually strain the healthcare system and the population. I think it's difficult. I mean, I know it's framed as like a public health or business. I think it's not that simple. I think at the end of the day, we need healthy people and healthy economy. And it's need a plan to match that.
Mm. Yeah, it's very interesting because a lot of the economy is also based on connectivity between people, and so is COVID as well for the transmission of disease. So it's quite straightforward to see how it's both in the benefit of the economy and of health and public health to get the cases as low as possible, and I would think also push towards elimination, even if you don't reach elimination. But failing while doing that, you've already saved thousands of deaths and saved much of your economy as well. And we see a lot of the countries that have managed to get to zero or near zero cases have benefited immensely. Besides the better known examples of New Zealand and Australia, and there's Vietnam and Thailand and Mongolia and Senegal and several countries, including low middle income countries, who have managed to achieve that. So there are a few examples. This is what zero COVID looks like, basically. Some images from New Zealand, from Vietnam. This is zero COVID is not just also for islands or anything of that sort. We've got millions and millions of people across many countries. These are various Indian regions, the largest of which has 34 million people, and then others with several million or down to about 1 million. So different sizes, different populations, and they're in the same country. But they've implemented also 2-week quarantines across regions, and the mentality, the mindset, really, even if when it's not framed in terms of a zero COVID strategy, the mindset of trying to get ahead of a virus, I think is a very important factor, not just waiting to see where the virus gets and then responding. So whatever strategy you're doing, I think that's a mindset thing, which is a huge advantage.
Yeah, for sure, of being proactive. Yeah, I mean, I think we saw that during the holidays that many countries, they didn't necessarily lock down, but they implemented restrictions before the holidays, before there was a surge. And I think that behooved them because a lot of places are now coming out of it without having overwhelmed the healthcare system. So yeah, there is something to be said for being proactive, and that's one purpose of modeling. I know that some people look at the models and critique it and say that's totally inaccurate, but the point of model is to help plan that you don't want it to look like that. Exactly. So if you can see where it's going and start to take decisions in advance, that's the point of modeling. And so yeah, I totally agree. And unfortunately, lockdowns are a very, very, very blunt instrument that it's a for last resort, in my opinion, because we see how it impacts people. And even at this point now in the response, it's having a limited, I mean, I think it's helping with spread, but it's definitely not getting to the point like where you were saying before, where it was basically completely flat in the very beginning. We're not having that sort of response on the outbreak from this lockdown. And so it's just, yeah, something has to give.
I think particularly with the ongoing crises that we have in Lebanon, the political, financial, economic crises, and how widespread and general prevalence of poverty. More than half of the population is living at or below the poverty line. It's a exceptionally difficult time the country is going through, and I would have thought a policy or a strategy that aims towards zero COVID, or at the very minimum contain at very low levels, would have been a no-brainer, because how much can one rely on having all their population have high vigilance, maintain the measures and masking and washing and ventilation, no crowding, and still have a functioning economy, still being able to work. A lot of people have to work earn their living basically on a daily basis. They have to work every day, and I find it unacceptable to have people choose whether to feed their kids or to stay at home and not get COVID. So for me, the choice would be, I mean, it's so that is really the mindset, I think, that I would have thought would have been wiser to get into.
Yeah, I think that's a really good point. There's such an intersection of the groups that are most vulnerable to all of these crises where the things intersect. And yeah, I think unfortunately there's so much overlap of the people who maybe would suffer the most, be most susceptible to severe illness or death with COVID are, unfortunately, there's a lot of intersection there. The people that don't have a choice financially due to other pressures, and that's difficult. I mean, that's why I was saying healthy people, healthy economy, and then the other part of that is like the support for the people that are most vulnerable. And this is even outside of COVID. You know, outside of health, we have. I mean, I'm in public health, so I view everything as health. So we really have to view it more broadly and how it intersects with other aspects of society. And I think that's what some people get really frustrated with the COVID response of, like, it should just be health related, but it's not. It is intertwined, and it should be treated as an interconnected issue. So you can have health policies, but if you don't have sound economic policies or other things going on, you can't continue to just treat it as an isolated issue. It's not isolated. Tell us about this graph, Jade.
Yes, absolutely. So this is an image of several countries by about mid-January, where Lebanon had reached number 6 in terms of highest per capita cases, COVID new cases, daily cases. We had reached a bit further than that as well, and we got into the top 10 in terms of deaths a week or two later. But here, this is an image to contrast countries that had followed the mitigation approach, including Lebanon, the US, France, UK, Netherlands, Germany, Canada, Denmark. Atlantic Canada, I think, is a particular exception. They've been very successful. They've gone towards zero COVID. And then we've got countries like Senegal, Mongolia, Thailand, Vietnam, Taiwan, several others as well. There's about 30 countries in the world that are managing to keep COVID at 0 or near 0 daily cases. I find it also very interesting that there isn't enough coverage of this, because success cases should be shown. There's a lesson to learn from them as well, not only the failures or when it goes wrong. But we can see all the zero COVID countries are almost parallel to the x-axis, right at the bottom. And even these have outbreaks from time to time, but then the scale of failure or of cases is far less, and they quickly clamp it down again.
Yeah, that's an interesting observation. It was just popping in my head how I think you're totally right. I've seen less and less commentary about kind of the lessons learned and things in common from interventions that are working, where it's working in different countries. I wonder if part of that is I think countries are just turning inward to some extent, particularly in places where you have noted mitigation, because there's so much going on, really just trying to manage as opposed to looking across the globe of what can be learned there. That's very difficult.
And let's see, we've got a little bit more along here. This is to briefly compare, actually. Different countries have had this Christmas impact, and we can see the UK, which opened up for a day against a lot of people's advice, but they opened for Christmas, and there was a surge due to that. There was Portugal as well, that opened for Christmas but closed for New Year's, and Lebanon, which opened for both, which I think was particularly harmful because at around their peak infectivity, whoever had caught it around Christmas would then, if they engage in parties and events, New Year's, then that is when they are around the time when they're most infectious. But Portugal particularly, ECDC has looked into it because they've been detecting also increasing cases of B117, the strain COVID first found in the UK, which is 50 to 70% more transmissible than the original strain. And they found that actually it was the gatherings that happened with the opening of Christmas, which was the major reason why Portugal had that surge. And the new variant the new strain was also responsible, but the major factor was the opening. And perhaps what has actually happened, because around sometime in January, Portugal around the middle of January went into a lockdown, but this new variant, despite the lockdown, can keep increasing to some extent. It's harder to get down. So that was one thing that Portugal also struggled with. In Lebanon, we know for a fact that the new strain is there. B117 is in Lebanon, but we don't have a good figure about how much, what proportion is it of total cases. But by now, it's maybe approaching or may have become dominant. Once it's the majority of cases, then this whole idea of having yo-yo lockdowns, and lockdown by itself is, as you said, a measure of last resort and shouldn't be. I think no country really should have a lockdown. Have a good strategy and never need to have a lockdown. Of course, once things get out of control, that's the last resort. But even the space between those yo-yo lockdowns will be even smaller with this new strain, because it just spreads much faster. And in the figure, we see Jordan, where there's less of this issue over that season. So there was a far better result over there.
Yeah, and I think they just reopened schools.
Oh, they did, okay.
Yeah.
Yeah, that's another thing as well, particularly with this new strain. There is an issue because the original one, there was quite a lot of debate whether or not children were more susceptible than was originally thought. And it seems there was a lot of under investigation and under testing among children, but to some extent they may have been less susceptible to the original strain. But with B117, that is no longer the case. So there are a few countries now reporting sharp increases among school children, and where they have schools open. This is to show briefly Denmark, because in Denmark as well, Denmark is very impressive in that they type most of the or all of the cases that they receive, that they detect. So it's got a very strong genomic surveillance. Not all of them, but a very big share. So so we have a very good picture. Both them and the UK are the most in Europe in terms of genotyping, gene sequencing the cases that they receive. And Denmark had been in a lockdown before, started shortly before Christmas. We can see that it peaked sometime before or around Christmas, but not after it. There was the lockdown in effect in terms of the COVID cases. And just to show the scale between Lebanon and Denmark. But during the lockdown, we see that the original strain or variant, people variably call them strain or variant, but there's a case to make that it's a strain. The original one decreased with the lockdown that began in week 50, 51, whereas the B117 has been increasing despite the lockdown. It's not stay at home, but all the shops are closed. Only supermarkets are open, and the schools have been closed, except for kindergarten for the smallest children. And it seems what I've briefly become aware of is that it may be stabilizing B117 at the moment. The R0 might be around 1 or just below 1 finally. But it just shows how much effort in a low density country, relatively, how much effort it takes to get B117 down.
Yeah. It's really interesting to see it laid out like this. And it makes me think that I've read some articles recently, how much of a push there is to then ensure that vaccine happens quickly before additional variants emerge that might be vaccine resistant. So it's one thing in the back of my mind when I was making that graphic for the vaccine rollout rate, thinking like, it's got to be fast because, and I think Dr. Abiad has spoken to this a little bit in terms of on media and Twitter of the risk of a variant if things continue to be delayed. So yeah, there's definitely that issue. I see Paul Basile in the chat box has asked about policymakers being reluctant to apply zero COVID. I know I also got a question about what lessons can be used from countries that are pursuing mitigation approaches. So I'm curious about your take on both of those things, Jade, in terms of reluctance and then opportunities with mitigation.
Right. Well, as far as policymakers, you mean, are concerned, yes. It's also a question that comes to mind quite often because I find it. I mean, it's very predictable. We know Lebanon. We know our country. We know the challenges it faces. We know there are multiple crises, poverty, widespread poverty. There's high density. Lebanon is one of the countries with the greatest population density. So all of this put together, and we're very relatively social as well. I find that it's a no-brainer that we should have gone for zero COVID. We were there, we should have gone there. Perhaps one concern is that perhaps some policymakers think that this is completely a dream scenario. It's unachievable. It's not possible. But I would say, on the contrary, I mean, it's the only alternative that can help us save thousands and thousands of lives and improve the economy, regardless of anything else. And we have also big problems with that. But there is no alternative, really. What do we do? Because it's not us who are setting the pace, it's the virus. The only way we can influence it is by preventing it from getting into people's bodies. And if we can't get the people away from the virus, then let's get the virus away from the people. So even then, when people do not comply to the level that we would like them to comply, and some will and some others won't, whether masking or hand washing or distancing, then there will always be a buffer. And with active surveillance and monitoring, as soon as there are outbreaks, you go ahead and clamp down on it. You isolate cases, you quarantine their contacts. It's not yeah, that's what I think in those terms. Of course, any lockdown, and we have done, in some ways, we have done the hard part already. We've locked down a couple of times already, a few times already. And that's the hardest thing, really, to do. It's very painful for most people to be locked down, and for the economy. There's no need for that. So rather than doing that again and again every month or two, instead, and this is the strategy that we had, and we still have, which can be adapted as well or updated, but in the short term, lock down, and importantly, provide financial support directly to people. Most people can't stay in their homes for 3 or 4 weeks. And then you get to a point where the levels are to a certain level that you can pursue containment. So it's no longer widespread cases and not being able to keep up. And you isolate cases, contain their, quarantine their contacts. And you can divide the country into a few regions, not too many. So whichever region that goes zero, has zero community transmission, then in that region, you can open up everything again. Factories and schools and shops, and you can get as close to near normal as you can expect. And once the whole country goes to zero, then it's about maintaining zero COVID. And again, you need the interventions at the airport, the quarantine, use of rapid antigen tests in a strategic way. So there's a lot of things we can use, and it is within our resources. Similarly, stretched or resource poor countries, similar to Lebanon, have managed to do this. So that is my thoughts on it. Perhaps since we are getting some feedback, we could open the discussion more broadly for anyone to participate by audio or video at this point. So
I'm going to call out Lena's question in the chat box too, about managing expectations around the vaccine, which I think is such an important question right now. And I put a response in there about messaging, but I think there are obviously the communication coordination between the entities and setting forth priorities. I alluded to this a little bit in terms of my vaccine slide of just some concern about an over-reliance on the private sector for vaccines, just the sense that a patchwork response is not going to work. It needs to be coordinated and across different entities and make sure that everybody's on the same page with priority groups and the goals. I mean, I know, Jade, you talked about goals earlier, and that's so important of like, what are we trying to achieve? And then I think there's still opportunity to grow that shared vision. And I see something from Tiffany. Have you been able to meet with any of the health officials to discuss this?
No, actually none.
That's a good question.
None whatsoever. Well, I will say one thing is that there are some individuals involved in the health system, whether in the public or private sector, who we have been communicating with one way or another. So that is one thing. So, but officially from members of committees or the main committee involved, there isn't any. And yeah, that's I find of course unfortunate. We aimed to be, and we still want to be, constructive with this. So we don't have a copyright over zero COVID. We would like anyone to take this idea, this mindset really, and push forward. My main concern is that with what has happened over the past few months, I think we need a new leadership, a new team, also because the structures of that are present in Lebanon don't make it easy sometimes to carry out such a response. Sometimes you can have committees and variable ministries, and the ministries might or might not be responsive or might have another idea, or it's the committee process is not, I don't find it transparent. It's difficult in those terms for citizens to engage with it. And it's not just, I mean, a lot of people in this, practitioners and researchers and others who can contribute to this have been largely left out. But I think the most important thing is exceptionally to make a team and give them the mandate to get this done, to get zero COVID done. And we will always be there to help them, support them out of our own time. But I think that is an important aspect of this, because I'm afraid that this might take a very long time. We're not going to, I think, reach herd immunity anytime soon. And one concern is that what might happen is, because this is taken from the national plan, they mention in the road from mitigation to containment of the outbreak, one of their points is that vaccine rollout in Q1 should protect the vulnerable. I don't know what other people's thoughts are about this, or Sarah, do you have any thoughts about that?
I have to admit, I had a bit of a visceral reaction when I read this portion, and that is because I did a shielding project in the very beginning for Lebanon, and while in theory it's a good idea, so I don't know if people are familiar with this idea of isolating or shielding. So it's making sure that those people who stand the highest risk of suffering from severe illness, so I mean generally we're talking about older people here, basically just keeping them home and then limiting exposure to other people. And so I had a visceral reaction to this because it's good in theory, but it's not possible. And this is my opinion. And it's because as long as there are movements between people and there's a reliance on others for food or services or whatever, it's just not possible. Yeah, I think it comes with risks to try to do this sort of approach that we've seen fail in other countries already. So I worry that it's also not applying lessons learned that we've already seen. Yeah, what were your thoughts when you saw it, Jade?
We at ZeroCovidLB have been interacting with some of the other groups, independent groups in a few countries, and others also have been posting about their concerns in their own countries and this drive to possibly open up everything or most things once you have vaccinated the vulnerable. And I find it very worrisome. Firstly, as you said, Sarah, I mean, this idea of shielding the vulnerable and letting things be, we've yet to see a single successful example, I think. And given that, in addition to the new variants coming in, perhaps some people would be aware of the Great Barrington Declaration, which is a political declaration that was made by a group and supported by various people in different countries, which basically calls for a focused approach. It says focused protection, basically, whether vaccines are involved or not. The point is shield or protect the vulnerable and let things be otherwise. And there are concerns that Great Barrington Declaration version 2.0 is coming in now, because this came out a couple of months ago, and now again there's this talk about vaccinate the vulnerable to protect them and let everything's open up. I should note that various international national health organizations and officials have been very critical about this declaration. WHO also considers it a very risky and unscientific approach. So there is some talk from different countries, whether in Denmark or in the UK, about opening up again once the vulnerable are vaccinated. And it is, of course, a strong temptation to, because you have this huge economic fallout from having to lock down and all the social distancing in place. So it seems at its surface a good idea, but as you said, Sarah, in practice, it doesn't work that way. And it's quite interesting that in January, Christian Drosten, the very well-known German virologist, had mentioned that to Der Spiegel. He highlighted his concern that, and I'll quote, once the elderly and maybe part of the risk groups have been vaccinated, there will be an immense economic, social, and political, and perhaps also legal pressure to end the measures. And then huge numbers of people will become infected within a short amount of time, more than we can even imagine at the moment. So we're talking about possibly a wave bigger than we have seen before across different countries. And it will, of course, it will be, of course, primarily younger people who are less likely than older people to have severe symptoms. But when a huge number of young people get infected, then the intensive care units will fill up anyway, and a lot of people will die. Just that it'll be younger people. So this is, again, I mean, it's a terrible scenario to contemplate, and that is unfortunately what I'm concerned about, and some of us are concerned about in terms of Lebanon, that there will be this temptation, of course, vaccinate, protect those few. That alone, even if you vaccinate all the vulnerable, all the elderly, is not enough, let alone when you don't have enough supplies and when there's also vaccine hesitancy, which is unfortunately a major issue. I think the misinformation that has been allowed and that happened has been very harmful, because a lot of people are reluctant to take vaccines, and we need to change this, of course, but this is not going to happen overnight. So, Sarah, any thoughts, or anyone?
No, I think you said it.
There is a question about the vaccines. Yes, it has been suggested before that perhaps to make an event that will focus on vaccines, and we will have it on our list of upcoming topics, hopefully at a future webinar. There are mixed results, and there are some vaccines where we have much more data than others. There are concerns, more recent concerns, about the AstraZeneca Oxford vaccine, and how effective would that be in terms of some of the new strains, new variants that have been found, which have first found in South Africa, another one first found in Brazil. So these are, of course, valid concerns. But I think at this point, we have such a small vaccine supply available for Lebanon. People should take any vaccine, any of the reputable, I mean, the widely known vaccines that have been administered to millions of people. Any of these vaccines that they can get their hands on. There are 2 from China, there's Sputnik from Russia, there's Oxford AstraZeneca, there's Pfizer and Moderna, and soon Johnson & Johnson, and at some point Novavax as well. So one would hope that we would be able to get the more effective ones or efficacious ones sooner. But at this point, any protection is better than none. And in any case, the vaccine alone is not going to be enough. You need this within a broader strategy. And this is again where Zero COVID comes in, because it's quite interesting that we are ignoring a lot of uncertainty. We have only a fraction, an idea of a fraction, a view of a fraction of the strains or variants that are circulating around the world. So we cannot base a lot of people's survival on such uncertainty. We have a solution today that works, which is going towards elimination, going with a zero COVID mindset. That can be done today. We don't need to wait for a year or two down the line to see maybe if we manage to do this. And of course, in the meantime, you vaccinate as much as you can, and that will help you maintain that zero COVID.
Yeah, that is one concern I have about, I've noticed in the headlines an increased move towards talking about herd immunity. And that's definitely one concern I have, is that it's kind of losing the big picture, the importance of still a comprehensive, responsive approach. Because I think you're spot on. There's still so many uncertainties. I mean, even with the vaccine, there needs to be clear messaging to get the vaccine, but even with the vaccine, there's uncertainty around the length of time of protection and effect on transmission. It's starting to look positive, but it's just, I am definitely concerned about the herd immunity narrative for a lot of reasons.
Yes, it is very concerning. And I mean, it's what can change the direction. I mean, we have a question regarding decision makers and how we can convince them. And I'm not sure we can. I think the only party that can is the people, the public. And if the public outcry will be sufficient, then maybe that might make a change. That seems to be what the situation we're in at the moment. We don't have, I think, in terms of herd immunity, where does Lebanon stand? No, I wouldn't think there's any data at the moment on that in those terms. I mean, we would expect, Sarah, you had something to share?
No, I mean, I think you're getting there, so go for it.
No, I mean, with the new variant, with the new strain, the B117, we need an even higher proportion of the population to be vaccinated, around 80% or more. And herd immunity isn't just this magical level that you reach and then, the thing dies out. It doesn't. It will go on in some pockets. It's just that the scale of things will be a whole lot less. And since we have a quarter of our population are children, and vaccination for children isn't yet happening or approved, but probably, I mean, that's where we're heading to, but then, more time. So it's very difficult to see getting to herd immunity now. And there's this issue of also the past infections and how much are these? Sorry, go ahead, Sarah.
Yeah, no, totally. That you read my mind. Yes, because I know some people have been trying to estimate the number of people who've been infected so far. I think in terms of establishing the argument of where we do stand with herd immunity, which is a very valid question, Kay. I'm not diminishing that at all, because it's part of the bigger picture. But yeah, in terms of Jade, the past infections, there's questions around the immune response there. We don't know how long it lasts. I think they've said it's at least 3 months, but we don't know. So even in terms of past infection, that's why a lot of international organizations are still recommending that vaccinations still occur among people that have even already had COVID. And so the number recovered is like a temporary way to look at it. It's like, it could be up here in terms of recovered cases, but it's going to drop in terms of, if they got COVID back in March of last year, you can't include them in that pool anymore. And more than likely, they don't have enough of immune response that they can contribute to herd immunity. So it's, herd immunity definitely seems very elusive right now, and too many variables.
Yes, and I think somehow, I mean, this subject has kind of crept in because of the failures that some countries or a lot of countries have had. I mean, it's always been that herd immunity is reached by vaccination, and there had to be a lot of emphasis on this point as well, that relying on widely infecting people is a very irresponsible approach. So that was a lot of the debate last year globally. But of course, it's understandable that it will be tempting to say, okay, you know, we have this proportion of our population with past infections, but it's like you said, it's not at a certain point in time. It's dragged on, so people risk getting reinfected, and particularly with new variants coming in, which have, it seems some of them have more likelihood of causing reinfections than others. And again, with the uncertainty, because who knows? I mean, right now we have the B117 strain, which spreads 50 to 70% faster, with a bit more mortality, but the main issue is the spread, the speed of the spread. And then you have some other variants, like the one first found in South Africa and Brazil, with, to some extent, having causing the vaccines to be less effective or efficacious. It's still, the vaccines still have a very good impact, so it's not nothing, certainly not. And it's very important to vaccinate as many people as we can. But we're also risking, you know, who knows what tomorrow brings, maybe even nastier variants with those two things combined. That would be a very big issue to be concerned about, because it's not like our opponent over here is trying to reason with us. The virus doesn't care about our opinions. It only cares about our actions. So we can't rely on uncertainty and that we won't be faced with greater challenges in the future. So might as well nip it in the bud now, go zero COVID, and enjoy the fruits. So by the way, also to building on that and what you said, Sarah, regarding the timeline, we know the experience of Manaus, for example, in Brazil. And in that city, it has a relatively very young population age structure, and they had a low infection fatality ratio, around 0.2 or so, something along those lines. I can't recall, but the virus just spread so out of control earlier last year, and then it dipped due to various interventions, but during the summer over there, and there were question marks about, has herd immunity been reached? Because at some point there was an estimate that 76% of Manaus's population had been infected by COVID. And then suddenly we start to see in the early winter cases rising up, and it reached at a point even greater than it was before. And again, they had a widespread outbreak. So would you like to take one of the questions, Sarah, or anyone would like to contribute anything? I haven't kept up with the chat, sorry.
I just saw Kay put one in the box. 300,000 have signed up. Yeah, that was the last figure I had seen. Yeah, agreed. I mean, it's people need to opt in to the vaccine first for these vaccine numbers to come to fruition. Of course, being in public health and working on COVID, the vaccine is an essential tool for this. And on the other side, especially in the Lebanese context, and because I'm speaking now, I know I'm an outsider from the US and I'm looking in, I also completely understand people's hesitance, just knowing and this is not me poo-pooing the government, this is me just acknowledging that distrust of the government is very real. So it's difficult. We've seen how distrust can play out in responses, and unfortunately, distrust is very high in Lebanon. And so I also completely understand the hesitance from that side. I think there's a whole load of misinformation as well. And I know misinformation spreads like wildfire on social media and just on like WhatsApp forwards. That's certainly part of the issue, but I think the government distrust doesn't help. And I hope that there will be increased messaging addressing both of these things, the distrust and the misinformation.
Thanks. Yes, I fully agree. There's a lot of work to be done ahead. I feel at the moment a bit disappointed that the lockdown got to here, and things are opening up. It's completely unethical to lock down without direct financial support for people. It's just not acceptable. And all the deaths that had happened, the thousands of deaths, were not necessary. This could have been prevented. And we're counting in terms of deaths, but what about also long COVID and harms, which are actually playing out over tens of thousands of people? That is also something to consider. It's not okay to allow cases to happen. And it's not just the overflow of hospitals. And vaccines are extremely important, but we also need to have other tools as well to prevent infections from happening in the first place. Over-reliance and just thinking that at least the severe cases will be prevented is not enough. We don't know yet, or we will know a whole lot more about the long-term impacts of COVID on people who survive this. But so far from what we know, it is not reassuring. There's a lot of the symptoms that we see in conditions due to among survivors of COVID are quite worrisome, including fevers, fatigue, brain fog, muscle aches, shortness of breath, palpitations, various conditions and rashes and things of that sort. And they also happen among the younger age groups, actually, if anything, more among middle and younger adults than among the older population, it seems, from the ONS data in the UK. And some of it lasts for 5 weeks, some of it for up to 12 weeks, and some even longer. So we know that 10 to 20% of survivors end up with this, and that is also not good for health, also not good for the economy. So the focus, the target should be to prevent every case, just as Mike Ryan at WHO had said. That is what we need to chase after. It's not okay to accept cases. I mean, that I would think is my thinking in terms of how we succeed, or what's the metric for success or failure. But there may be others out there as well, or other opinions.
No, I appreciate you mentioning that, because it's not just about the case numbers. There's all these other consequences that happen that aren't so easy to capture in the data. Yeah.
Thanks. Well, I think we've covered a lot of what we had planned to cover, and a bit more today. Unless there's anything that we had missed, or any last comments from Sara or any of the participants with us today?
I just wanted to say thank you, Jade, for hosting this, and for Zero COVID for the invitation. And thank you everyone for joining today and asking some great questions and being so engaged in the conversation. We know that you're part of this response as well, and keeping others informed. So thank you for coming.
I'd like to thank you, Sara, very much for joining us today. It's great to virtually meet you in this way, finally, and we're very thankful for all the efforts that you are personally doing and giving from your time and effort to help Lebanon and all the people involved. It's been really a pleasure to see you in action and get all the support that Lebanon needs. Thank you, everyone, for joining us today, and I'd like to wish you a good evening, and this video will be up within a day or two on the website. Thank you, everyone.
Thank you. Thank you very much.
Bye.
Bye-bye.